Do you ever wake up with a dry mouth, bad breath, or feel unusually tired? It might not be your late night habits, but something as simple as how you breathe. Today, we're uncovering the unassuming yet impactful issue of mouth breathing. We'll dissect what it is, why it matters, and what you can do to prevent or correct it. Stick around till the end, as well we'll share some practical, life-changing tips that can improve your breathing habits and overall health. Our bodies are designed to breathe through both the nose and the mouth. However, when the mouth breathing becomes our main source of oxygen, especially during the sleep, it can lead to a host of health problems. Mouth breathing is typically a compensatory mechanism for when nasal breathing is obstructed. Nasal obstruction can occur from allergies, colds, or even structural problems in the nose. Long-term mouth breathing can cause a cascade of health problems. Children might experience crooked teeth, facial deformities, or slower growth. In adults, it can lead to bad breath, gum disease, and may even make symptoms of existing illnesses worse. An additional, often overlooked consequences of mouth breathing is that it decreases saliva flow. Saliva, packed with minerals, help neutralize bacteria, clean off the teeth, and rehydrate the tissues. When this is reduced, the risk of gum disease and cavities escalates. In contrast, our noses are marvels of natural engineering, providing significant benefits. The nose produces nitric oxide, which helps in oxygen absorption and also acts as a filter, adds moisture to the air, and warms the air to the body temperature before it reaches the lungs. But how can you tell if you or your child is a mouth breather? And what are the precise effects on health? Stay tuned as we unravel this. Some symptoms of mouth breathing include snoring, dry mouth, bad breath, fatigue, brain fog, and dark circles under the eyes. In children, look for slower growth, large tonsils, dry lips, problems at schools, and daytime sleepiness. As we previously mentioned, the underlying cause of mouth breathing is usually an obstructed nasal airway. There can be several culprits like nasal congestion, enlarged adenoids or tonsils, deviated septums, or nasal polyps. But it's not just physical. Stress and anxiety also trigger mouth breathing. There are serious risks associated with chronic mouth breathing. It can cause bad breath, periodontal disease, throat and ear infections, and even decrease lung function. Healthcare providers have a few tests to diagnose mouth breathing. The lip seal test checks if you can breathe with your mouth closed. The second test is a mirror test. It is for seeing whether you're breathing through your nose. They hold a mirror under your nose and look for condensation. The third one is the water test. It checks your ability to hold water in your mouth. Mouth breathing, by the way, isn't a new concern. American painter and author George Catlin, who lived during the 19th century, noted the ill effects of mouth breathing in his book The Breath of Life, later called Shut Your Mouth and Save Your Life. He observed the Native American communities he encountered during his travels. They preferred nose breathing, which he believed contributed to their perfectly straight teeth and robust health. They believed mouth breathing made an individual weak and caused disease, while nasal breathing made the body strong and prevented disease. If you suspect that you're a mouth breather, don't panic. There are many strategies you can apply to change your breathing patterns and improve your health. One trending remedy is mouth taping.
I've been doing this for 30 days. Now, I'm sure your first obvious question is, why would anyone tape their mouth shut while they slept for 30 days straight? Well,
it's as simple as it sounds, taping your mouth shut while you sleep. Some advocates say this solution is transformative, aiding in quieting snoring, preventing morning dry mouth, and helping you to convert to nasal breathing. The hashtag mouth taping has garnered more than 51 million views on TikTok. But it's essential to remember that there's little research examining its effectiveness and side effects. Always consult your healthcare provider before trying such method. It is important first to understand what's the underlying cause of you breathing through your mouth. Do you have a problem through your nose? Is that something blocking your nose from breathing? Try to understand that first before trying other solutions. And the best way to do it is to go ask your doctor, ask your health provider, and they will tell you or just examine you and understand what's the underlying cause. You can also try other preventative and corrective methods like nasal sprays to reduce nasal congestion, exercising regularly to improve respiratory strength, using a humidifier to prevent airway dryness, and consciously practicing breathing through your nose. Yoga is also beneficial, especially for people who breathe through their mouth due to stress, because it focuses on deep breathing through the nose. So remember, mouth breathing, although often overlooked, can have profound effects on our health. From causing physical abnormalities to affecting mental well-being, it's an issue that needs addressing. Whether it's through medical treatment, lifestyle change, or preventative measures, it's important to act and consciously ensure healthy breathing habit. So start today.